This is the Introduction to Adolescent Medicine video. During this presentation, we will be covering a basic introduction of adolescent medicine. I know that you're eager to go see patients, so we're going to just be going over some highlights of the adolescent exam and discussion. So first, we will discuss the approach to the adolescent patient and how to interact with both patients and their parents. Next, we will review the HEADS exam, and last, we will go over some of the legal rights of adolescents in California. So first, with working with an adolescent patient and their parent. Working with an adolescent patient and their parent, as children reach adolescence, they begin to exert their independence from their parents. This can lead to tension in the relationship. As a provider, you will need to know how to work within these relationships to care for your patient. So first and foremost, your patient should be your primary focus. This may put you at odds with the caregiver at times, but you are the patient's doctor and therefore their advocate. Second, even though the adolescent is your primary concern, you must always acknowledge the concerns of the parent. They also have a vested interest in the well-being of the patient and are a part of the care team. It is also important to address all of their questions and concerns. This should be done in front of the patient as much as possible to nurture trust. 3. It is important to be an authority figure without being an authoritarian. Adolescent patients are in need of guidance and respond well to someone who hears their concerns and offers firm, confident advice. It is important not to be condescending or overly strict with these patients because just as adults, they may rebel. Finally, it is important to always speak to the patient alone. This is the time to go over the HEADS exam and discuss any sensitive issues that the patient may not feel like talking about in front of their guardian or their friends. It's the HEADS exam. The HEADS assessment allows the provider to go over the most important of the social and environmental factors impacting the patient's life. As previously stated, this should be done in the private with only the patient and provider. In this section, we will also provide you with some key questions that may be helpful when performing each component of the assessment. The first component of the assessment is H for home. And you would like to know where does the patient live, who is their guardian, or do they even have one, and most importantly, do they feel safe at home? If they do not feel safe at home, it is important to find out why and get the proper authorities involved, such as CPS or the police. Next, we'd like to go over their education and employment. This is very important to know what their interest level is. Are they going to school? What kind of grades are they getting? How are they performing in school? Do they have a job? If they do, where and how many hours per week are they at work? Do they like their work or school, and what are their stressors? Next is activities. What do they like to do for fun? Who are they hanging out with, and in what extracurricular activities are they performing? This is also the time to assess whether they're involved in any crime or any dangerous activities of that nature. Next, you want to ask about drugs. Especially in the adolescent population, this is a time for experimentation. So you'd want to know if they've ever tried drugs such as tobacco, alcohol, marijuana, or any other recreational drugs, or prescription drugs that they might be taking from their parents or other guardians. You want to know what kind of drugs they're taking, how often they're using, and how it's impacting their life. And then you would also want to assess whether they are trying to cut back, cut down, or stop using drugs. And if so, you can hook them up with resources to help them on this track. Next is sexuality. Adolescence is time for sexual exploration, and so you want to assess whether they're attracted to men, women, or both. Also, you want to know if they are using contraception and engaging in safe sex practices. You want to also assess whether they feel safe in their relationship, if they feel comfortable saying no to their partner, and if there's any issues of domestic violence. Also, you'd want to know if they've been tested for any STIs. Suicide and depression is next, and this is important, particularly with an increase in teen suicides of late. So on a scale of 1 to 10, how happy are they, and what would it take in order to become a 10? Have they ever experienced bullying? If so, what kind of bullying? Is it cyberbullying or is it school? Have they ever discussed this with anybody? And have they ever considered hurting themselves or wanting to hurt other people? The next component that we're going to go over is adolescent health rights in California. Adolescent rights vary from state to state, so if you practice in another state later on, you will want to learn what the rights are in that particular state. So for general health, a minor can consent to care if all of the following criteria apply. And a minor is any patient under the age of 18 who has not been legally emancipated. So the criteria is if the minor is 15 years or older and is not living with a parent or guardian, and that time separation is not relevant. It could be a few days or it could have been several months. and if the minor is managing his or her finances. And the physician can inform parents or guardians of care without the minor consent unless the provider feels that this will negatively impact their relationship with the patient or cause harm to the patient. For the emancipated youth, they can basically be considered adults. They can consent to all dental, medical, and mental health care without notification of an adult or their former guardian. For emergency services, you can proceed with treatment for any severe pain or medical condition that could lead to grave disability or death, and not be held liable for not obtaining informed consent previous to treatment. The parent or guardian has a right to the medical records unless the physician believes this will cause a detriment to their relationship with the patient or harm the patient. In the cases of child abuse or neglect and obtaining x-rays, parental consent is not needed for any x-rays that are going to be used for the sole assessment of child abuse. Reproductive rights. A minor of any age can consent to prevention and treatment of pregnancy. This includes obtaining contraception and an abortion. It is illegal for a healthcare provider to share this information either verbally or written with the parent or guardian without the patient's express written consent. Sexual assault and rape. A minor can receive treatment and consent to the collection of medical evidence in the cases of sexual assault and rape. For minors less than 12 years old, a parent or guardian should be notified of the event unless the parent or guardian is thought to be involved. If the minor is 12 years or older, the parent is only notified of a sexual assault or rape with the express consent of the patient in the written form. For sexual assault and rape, they are considered child abuse, and authorities need to be notified of all events. Parental notification may occur during this investigation. Infectious and communicable diseases and STIs. A minor 12 years or older can consent to the diagnosis and treatment of any reportable communicable disease. Please see the link to the CDPH California website for a list of these diseases. This includes STIs and HIV/AIDS. For STIs, they can also consent to prevention services, such as the HPV vaccination. It is illegal for a healthcare provider to share this information with a parent or guardian, either verbally or through the EMR, without the patient's written consent. Outpatient mental health services, shelter services, and drug abuse. Minors 12 years or older can consent to outpatient mental health treatment or counseling if the provider believes that the minor is mature and intelligent enough to participate in the treatment or services, and if the provider feels the patient is at risk of serious mental or physical harm if they are not given services, or the minor is a victim of child abuse. The parent or guardian is needed to consent for ECT, psychosurgery, and administration of psychotropic drugs. The provider is required to involve the parent or guardian unless it is inappropriate. The minor consent is needed to disclose all medical records. Drug treatment. A minor 12 years or older can consent to medical care or counseling related to treatment or diagnosis of drug or alcohol-related problems. A minor can refuse a drug test. A minor cannot refuse drug treatment that has been authorized by a parent or guardian. It is illegal for a healthcare provider to share this information with the parent or guardian without written consent, unless the provider feels that the minor poses a threat to self or another, and disclosure to the guardian can lessen this danger, or if the patient is unfit to make decisions based on extreme youth or lack of capacity. In conclusion, I hope that this has offered you an overview of the adolescent exam and assessment. There are other resources that are available to review if you are interested in further materials. Thank you for your time and attention.